Hey folks, welcome back to the podcast. Today's episode is about hair. It's about restoring your hair if you've lost it, preventing hair loss, slowing hair loss, understanding where you're at in your hair journey. My guest is Dr. Alan Bauman, who is he is the leading authority when it comes to hair restoration and preventing hair loss, and then the restoration part, of course, which is what to do if you've already lost your hair. What are your options? So this episode is not just geared to men, because women lose hair for a variety of reasons as well. So men, women, buckle up. You're going to learn a lot in this episode about why we lose hair and what we can do about it, and all of the amazing techniques that they employ at Bauman Medical to understand why you're losing your hair, where you're at, and then to track your progress when you start different types of interventions. And the interventions from Bauman Medical can run anything from using a different shampoo and supplements right up to surgery to replace hair follicles. So I'm going to let Dr. Bauman tell you all about it. If you are looking to connect with Dr. Bauman himself, you can go to baumanmedical.com, and he does do virtual consults, and his team will be happy to help you. If you want to go to that website and buy some of the amazing products that they have, I'm personally using their shampoo and conditioner right now. They've got an incredible biotin supplement as well. You can go to the link HAI.RS/Niddam. So that's hairs with a period in the middle, HAI.RS/Niddam, and you'll get a discount on anything that you purchase on that website. So thank you so much for being here. Totally appreciate you guys. If you're trying to get in touch with me, you can go to my website, natniddam.com. You can send me a message through there, or you can join my new community on Mighty Networks called BSP Community, which you can also learn about on the website. We do amazing things in there. I do live Q&As every month. We do peptide deep dives. We have experts come on live and do Q&As. So in December, we had Caleb Greer, from episode 129 on terzepatide, I believe it was. That was a huge one. And all of those expert Q&As, whether it's with me or someone else, are recorded. So even if you missed the live, if you join the group, you get access to the recordings. And we do lots more other stuff that's really exciting in the group. Learn about it on the website. Otherwise, you can go to Facebook to the Optimizing Superhuman Performance group. That one's free. It's big. It's a little bit wild and crazy, but it's kind of a fun place as well. So I will leave you with that. Thanks again for being here, and enjoy the show. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Dr. Alan Bauman, it is such a pleasure to have you here today. Thank you so much for taking time out of your schedule to talk to me.
Great to be with you, Natalie. Great to be here.
Yeah, no, it was great to meet you in person. Actually, we've met in person twice now, right? Once in, where was it? West Palm Beach. And
Biohackers Live.
Biohackers Live, and then at the Biohacking conference in LA. So
that's right.
So always a pleasure to meet you. And I'm always wish that I wish I had more time to pick his brain a little more. And so now here we are. We've got a whole podcast to fill. So
great.
Yeah, and you're in this incredible business of hair restoration. I think, is that the best term for it? Hair restoration? Or what would be the best terminology that you would, it's Bauman Medical, which is, which really speaks to the fact that you're approaching this not just from a lifestyle kind of stopgap perspective, but from a medical perspective. But is hair restoration the right term?
Yes. Well, I'm an MD and I'm a board certified hair restoration physician. That's the American Board of Hair Restoration Surgery. And Bauman Medical is my practice that I've had for over 25 years here in Boca Raton, Florida. And today we have what I would call like a hair hospital. And so we cater to anything that has to do with scalp health and hair growth. And so a lot of folks maybe in the old days used to consider themselves a hair transplant surgeon. And, of course, that's what I'm primarily trained as. And that's the bulk of what we do here in the practice, literally hundreds of procedures every year. But I do see 1,500 patients per year. And many of those patients may never, ever need a hair transplant. And so that's the treatments that we offer to help protect and enhance your own living and growing hair so that you can help avoid a transplant or maybe not need as many of them as you go down along into the future.
Yeah, that's amazing. And I love the preventative aspect to that, right? Because, the hair transplant, it's kind of like the final frontier. It's the last stop on the road. I actually have a client who had a hair transplant procedure with you this year. And
Okay.
and again, like you mentioned something, I don't know if it was before the podcast or here, it wasn't about plugs, like he didn't look like he had a bunch of pokey things. It was a very, very interesting and didn't look anything like what I would have expected it to look like.
Yeah.
It looked
And
quite
I think that's,
natural.
yeah, that's the most common misconception about what I do as a profession, really, is that people think hair transplants are pluggy and painful, that they look weird or unusual. And that was true maybe like 20 something years ago or more. But today's technology is completely different. So we are moving around literally as little as a single follicle, one at a time. I mean, that's what the microsurgical loops are for, right? So
Wow.
that we can graft those hair follicles one at a time and also use artistry to create something that looks normal and natural. So, I mean, just to jump right in for you, I mean, a hairline shouldn't be flat and straight and hair sticking out like porcupine spikes. I mean, that's not what a hairline looks like. Mother Nature doesn't create hairlines like
No.
that. So, my mentors always taught me to be a student of nature and to look at natural hairlines, look at the patterns that Mother Nature produces on the scalp, and recreate that surgically if you can. And of course, that's what drew me into the field of hair restoration over 25 years ago when I was in my plastic surgery training in Manhattan. I really didn't know much about hair transplants, and I was just like everybody else. I thought it was pluggy and painful, and why would you even bother?
Yeah, yeah.
Until I met that patient who had had the work done
Yeah.
and I was unable to tell. He
Oh,
was thrilled that he fooled the doctor, so to speak.
no
And
kidding.
we entered into a really interesting conversation from there. From a layman's point of view, he told me about his hair transplant. I was amazed at his results at that time. I'd never seen one that good. And the other thing that struck me was how his life was changed from the
Hmm.
procedure. And that I already knew that, cosmetic enhancement could make a big impact on someone's life and how they perceive themselves. And of course, in the biohacking realm, we're always trying to work on the inside, make sure that we feel good, that we have more years in our life and more life in our years. But, the outward expression of that is important too, because our skin and our hair is an important barometer of how we're doing on the inside.
Hmm. Yeah, no, that's such an important point. The whole psychology around preserving a person, like, maintaining a decent head of hair, which I guess, isn't to say that, there are definitely men out there who choose the no hair look, like being bald as their look, and they're confident and they're happy and that works for them. So I think there's a lot to be said for that as well. But, to have, and I think that the options today available to people who are trying to either reclaim their hair or preserve their hair, and I guess that's two different areas in a way, are so much broader than they used to be. But before we get into that, I think, just to position the podcast a little bit, this is as relevant for men as for women. And I would love to talk a little bit about some of the different reasons why men, I mean, we know male pattern baldness, right?
Hmm.
Um, Everybody knows about that, right? Like, I mean, my dad, it was a genetic thing at a very young age, like in his early 20s, started to lose his hair rather aggressively.
Hmm.
But for women, it's a whole different set of circumstances, really, even though there is
Correct.
androgenic hair loss as well, which has to do with male hormones. So maybe
Sure.
you want to I kind of butchered that a little bit, but maybe you.
No, no worries. I mean, certainly, male and female pattern hair loss are the primary things that we treat, and we know that there's probably 80 million Americans out there who are struggling with some kind of a hair problem. Most of them are men, but a lot of them are women. There's about 30 million American women out there who are struggling with hair thinning and hair loss. But it's almost like a hidden condition because, as you said, you can see from across the room a guy's receding hairline or a bald spot, or if they choose to shave their head, a personal decision, obviously, to let go of their hair, no worries. And there's a lot of socially acceptable folks, acceptable icons, if you will, that folks look up to when it comes to that. It could be, Dwayne the Rock Johnson or whomever is your hair hero, right? But for women with hair loss, there's no socially acceptable, female icon. I mean, you're not going to like run out and go look like Sinead O'Connor right away. Like if that's your hair hero, you've got some problems. And Jada Pinkett Smith obviously, took a clipper to her hair, for whatever reason, maybe we know, maybe we don't, but, obviously she was upset about her hair and had done a lot to kind of torture her hair over the years pretty publicly, with different styles and colors and straightening and chemicals and heat and things like that could certainly damage her hair and make you want to just shave it all off, unfortunately. But for women with female pattern hair loss, it goes undetected from across the room, but women notice it in their brush, right? They see the shedding that's happening. They notice the change in their ponytail volume. They might see those subtle signs, like they have to maybe change their part line to get more coverage, right? Because female hair loss happens right down the middle. So in the frontal zone, instead of a big recession of the hairline, like in men, with the hairline is usually pretty stable in the center, but they lose density diffusely in the middle zone. And then it's not until a little bit later on with age that sometimes we see some recession of the temple areas. And that can be really disconcerting to women. And that's one of the more common areas that we actually have to transplant to restore a more youthful and more feminine frame to the face.
Interesting.
Yeah, but there's, for men, just in terms of the triggers, we know it's hereditary. There's a sensitivity to the androgen DHT, dihydrotestosterone, which is a metabolite of testosterone. And that's the trigger for the miniaturization that occurs over time. But there are other influences on hair, and women especially have what I would consider more sensitive hair. So 40% of our patients at Bauman Medical are women. And they come in with the concerns of thinning or shedding, loss of volume, maybe a little recession of the hairline, maybe thinning up top and more scalp shining through. And they're doing camouflage techniques, changing their style, changing the curl, changing their coverage and so forth to compensate at that moment. And it's just in the early stages, hopefully. But if it's gotten to be more severe, then we have to take more severe action. But we do a complete diagnosis to figure out what's going on. What are the other influences besides hereditary causes that could be influencing the hair follicle?
Yeah, no, that's really interesting. So for women, what would you say the main drivers are of hair loss? Because I know that, autoimmune conditions could be a major issue. Thyroid imbalances can contribute. Even diet, like poor digestion or not eating enough protein or not breaking it down. But what are the things that you're seeing are the most prevalent for women? And, if somebody corrects some of those things, like the autoimmune or the thyroid or the diet, do we see the hair coming back? Or like at what point does it become a problem that has to be solved in your office versus a lifestyle change?
Right. So it's really important to get a complete history because we know that everything is like painted on the canvas of the DNA, right? And so your DNA tells you whether you're going to be susceptible to certain things or not. And, that's the main driver of androgenetic alopecia is the sensitivity to the male hormones that you may be having in your body. And all women have those hormones, but hair follicles are extremely sensitive. First of all, they're highly complex, right? They sit in the scalp and you think that these are tiny little things. Obviously the hair you see is dead, but the follicles are under the scalp. Think of it like a 3D printer that's making the hair fiber, and it requires metabolism to make that happen. And hair follicles are one of the most highly metabolic cell populations in the body. So think of it, God forbid you needed cancer therapy. It knocks out your GI tract, your bone marrow, your immune system, and your hair.
Yeah.
Why? Because those are highly metabolic, highly replicating cell populations. And so as the things that you mentioned, like poor nutrition, could certainly impact the hair follicle. We know if you're protein deficient, a lot of patients come in and they're on strict diets like vegan, vegetarian diets, and they're not getting enough protein to build good quality hair. And that's a very important concern. You need to make sure you have adequate protein. There's stress, obviously, in the day and age of a global pandemic and economic meltdown and political unrest across the world. We got plenty of reasons to be stressed out. And so that's why, of course, mindfulness and meditation is important. But, stress as a cortisol effect, right? The prolonged exposure to cortisol can shut these follicles down. And we know that just from laboratory experiments. The quickest way to turn off a follicle is to put some cortisol in the petri dish. Wow. And so the follicle that's stressed makes its own cortisol. So we want to take a look at that. What you do to your hair from the outside, pulling or torturing it, with heat and chemicals and things like that. These things definitely have an effect on hair follicle function, as even just UV radiation, ultraviolet exposure, just being outside can degrade the follicles over time.
Really?
And disrupt the hair. Yeah, disrupt the skin, disrupt the hair, and make it more difficult to grow good quality hair. And so we want to look at all of those things. But as you said, hormone imbalance, for example, the most common hormone imbalance in women of childbearing age is PCOS, polycystic ovarian syndrome. And one of the most common symptoms is hair problems, hair loss, as well as hair growth in other places. Like they could get hirsutism on the face, they could have weight gain, they have acne. These are androgen sensitivities that are out of whack. Right? Either androgen levels or androgen sensitivity that throw off these side effects and symptoms of PCOS. And so we know that that's a common factor. There's the androgens when it comes to female hair loss. But you mentioned perhaps thyroid and inflammation, changes in the female hormones, even after childbirth can trigger a shed. We can sometimes see it, perimenopause, menopause, postmenopausal. That's the time that most women experience the hair problems, and these genetic tendencies are revealed during those times.
Nice. Yeah, it's interesting when you talk about pregnancy, because usually quite often during pregnancy, women have this beautiful head of hair, right? Like I think the hormonal environment is such that, and they're anabolic, right? They're building. And so you get this beautiful head of hair, and then post delivery, there's often kind of like a rebound effect where there's this massive shed. But I think for the most part, in a woman who's healthy and who's able to recover well from childbirth and is able to take care of herself as well as her baby, there's usually a recovery on the other side of that, right? As long as there's not a lasting. And I mean, one thing that goes south, I think a lot in pregnancy is thyroid. Thyroid takes a massive hit. It doesn't get diagnosed. People expect people to feel tired and whatnot. And then, then I'm sure the hair loss is sustained.
Even worse. Even worse. And there's other metabolic syndromes that occur, could potentially occur during pregnancy as well. But you're right. Most women are growing amazing hair during pregnancy. Then they pop the baby out and boom, 6 weeks to 12 weeks later, there's a massive shed. It happens super fast and it's scary. Most women who are healthy, as you say, can rebound from that quite easily. But what I see are those that don't. And, that's the segment of the population that we end up treating, because if we've given it enough time and the follicles are just simply not bouncing back, a lot of women come in and they say, ever since that second child or, whatever, ever since that time, my hair's never been the same. And so that's a common thing that I hear in my consultations as we're digging through their medical history. And that's one of the things that I like to do. I like to take about an hour with patients to really do a deep dive into their nutritional status, not just is there hair loss in the family, what's their history of hair loss risk, what's their hair styling regimen. And there are certain ethnic populations that, just need to do more to torture their hair to get it to do what they want it to do than others. And, sleep-wake cycles and all of those things that we work on, and again, the stress level that's been kind of pervasively high and got higher recently.
No kidding.
Certainly didn't help the situation, overall health.
Yeah, actually, you know what? Why don't we talk about, and this I think will apply to men and women. I want to talk also about men and the other reasons why men lose hair. But let's, the elephant in the room, the COVID elephant in the room, which is so many people, even who get through COVID quite easily, seemingly easily, notice that 2 or 3 months after they've recovered, there's this big shed that happens. And so are you seeing that? And what do you think is driving it? And do people typically recover on their own from that? Or do they need some kind of intervention to assist the recovery?
Yeah. So Natalie, I've seen over 1,000 COVID-related hair loss patients in the practice over the past 2 years, and it can be very devastating. And honestly, to me, it was not surprising because we knew the Spanish flu of 1918 was really the first time that we saw post-febrile telogen effluvium appear in the medical literature. And so we always knew years before and years ago that if you had a high fever, typically, or you were fighting off some kind of an infection, there's something going on, this inflammatory process in your body, and you're going to have some shedding that's going to occur from that, usually a little bit down the road. Let's call it a month or two. And so this is not unexpected. The amount of folks that come in who had a mild case of COVID and had severe shedding just blew my mind.
Really?
It was incredible. And, telogen effluvium is the fancy name that we use medically to describe a shedding phase. And the amount of telogen effluvium was just off the charts during COVID. And you can imagine, even if you didn't catch COVID, but you were locked down, shut out, you couldn't go to special events and things like that with your family, and you're losing, social connections. That's a very stressful time as well. So that's the lockdowns were compounding the stress as well as the infections. It's been a nightmare out there. And then don't get me started on the dysregulation of the mRNA, from the artificial mRNA vaccinations. We know the spike protein now is what dysregulates the immune system. I've had a huge number of patients that have come in who had stabilized alopecias, like say autoimmune alopecias, that were stable for many, many years, maybe a decade or more. And then all of a sudden, whether it be COVID or vaccination or what have you, they have a trigger. Now they have patchy hair loss or severe hair loss happening. And one of my colleagues had a little bit of alopecia areata on his leg for many years that came and went, and got vaccinated, and boom, it turned into alopecia totalis, which is the loss of all the hair on the top of his head and his eyebrows and everything. So it's a pretty serious thing. Is it autoimmune related? Probably.
It sounds like it. Yeah.
A severe situation there. We've heard of a lot of Guillain-Barré triggers and things like that from vaccinations. And I also think that there's some dysregulation at the level of the microvasculature as well, because we see all these cardiovascular effects, right? We see young men, keeling over, dropping dead on the soccer field and the football field in numbers that we've never seen before in the history of these sports. And so these young athletes, Olympic athletes, dying doing what they love to do, in a much greater number than ever before. And so who knows? But I think we're going to find out that there's some other effects that we just didn't count on. And, if you disrupt the microcirculation to the scalp, you could bet you're going to have some hair loss from that.
For sure.
No question, because many of our treatments are trying to boost that microcirculation. And, certainly COVID and spike proteins and mRNA can do all of that to you.
Wow. So then what's the end? Like, are you able to help those people? Are you able to help them recover their hair? I mean,
well, absolutely. I mean, look, hopefully the follicles are still there. They're not dead and gone. They're not beyond repair, unless they're maybe at the tail end of a male or female pattern hair loss process. We can boost those follicles. So there's a lot of ways to do that. Yeah, we want to do everything nutritionally and nutraceutically first to decrease that inflammation in the body. So maybe we're looking at curcumin, turmeric, things like that. We're reducing stress with ashwagandha. And we're looking at sleep-wake cycles. Get that rest, get that deep sleep going for regeneration and repair in the body. Let's cool everything down. And then, there are a lot of new treatments. I mean, literally just within the past year, we have a new treatment specifically for shedding that, we never had before. It's a transepidermal delivery of peptide proteins specifically for hair growth and shedding, to blunt the shedding. And so that's been working very well. Other regenerative medicine techniques have worked very well for the shedding phase, like PRP.
Yeah.
And these things that have anti-inflammatory effects like red light therapy, so forth, taking care of that inflammation, and then adding in other therapies like medicinal treatments, perhaps minoxidil or others, to really stimulate the follicle and to boost the follicle. So there's lots of ways to resuscitate growth if you catch it early enough.
Right. So you're basically at save the follicle first.
Yeah,
it's like preserve that follicle. So because once the follicle's gone, that's when we're looking at the transplant. So you said
the environment, really, it's really the environment of the follicle. We call it the niche, right? Because the niche is where the follicle lives within the skin. And there's the component of the fibroblast, which is the skin around the follicle. And then there's an adipose component, which is just below the follicle that has the energy delivery system. And then there's nerve endings and blood vessels and sweat glands and sebum glands, sebaceous glands and such. And even a muscle, that pulls the hair follicle when you get cold or when you're, emotionally aroused. And so those are all of the things that are affecting the hair and the scalp in those areas. And we got to try to preserve and protect that environment, and then really target the follicle so that we can get some growth going.
So you mentioned the adipose layer. Is that one of the reasons? I mean, is that one of the contributing factors? I could think of others of people who lose a lot of weight, who then lose their hair. Now, there's going to be, they're not eating enough protein, they're not eating enough, there's stress, there's inflammation, like all the other reasons. But is there a level of fat loss where that adipose layer, which I guess is what you're describing it a little bit as a repository of energy for that follicle, gets affected?
Yeah, we don't really know exactly what that relationship is, but I think we have some clues. So we know that very restrictive diets, whether you're doing long fasting time, and even intermittent fasting for long periods. I do a 5-day water fast, and people who do that routinely can often have some shedding phase. If you have, again, we mentioned, vegan, vegetarian, obviously there's some protein issues there, maybe some other things that are going on.
Yeah.
So yeah, very restrictive diets, or even, folks who have had bariatric surgery, which is surgery to lose weight, they lose a lot of hair because they're losing weight fast. So is it depleting the adipose tissue at the scalp? I don't know necessarily that we have that answer, but I will tell you that if you look at the research that was done well over 20 years ago now, we know that there are growth factors and gene expression that's happening in the adipose tissue that contributes to turning on or turning off the hair follicles. So there's communication there. That's the niche, if you will. So not just communication up and down the follicle from the stem cell center to the dermal papilla, which is where the proliferating progenitor cells are, but also from those areas in the local zone where we see the fibroblasts and the adipose. All of those contribute as well to the signaling of the hair follicle, turning follicles on and off.
It's amazing that every hair follicle has its own little, and when you think about it, there's like millions of hair follicles here.
Well, 150,000.
Sorry, 150,000. It's like a good, there's a lot, right? And each one has its little
there's
ecosystem.
a biblical saying, like every hair on your head is numbered or something like that.
Is it really?
Yeah, something from the Bible. I don't know.
I missed that. Now, you said a magic word to this particular audience earlier that I think everybody, if I don't ask you about this, they're all going to be on me about, why didn't you ask? You talked about TED Tech and you mentioned peptides.
Oh, yeah.
And, a lot of the audience that listens to this podcast is like all about the peptides. And I know that the first time that I heard anybody talking about peptides, one of the things he talked about were a number of peptides that could be used to stimulate or preserve or recover hair. And let me see if I can remember, there was zinc thymulin, there's GHK, there's PTD DPM or DPM TPD. I don't know if I got all those letters in the right order. I want to say there's probably
don't forget TB4.
TB4, I get zinc thymulin.
TB500.
Or TB500. Are those the peptides you're talking about? Or is that, because I know that a lot of people in the groups are like, okay, they ran out. Oh, and valproic acid was another element in there. So they ran out and bought a bunch of this stuff and I don't know if they were, if they were using it systemically or trying to somehow get it into their scalp. And for the most part, the results were underwhelming. So it sounds to me like there was a piece missing to the puzzle.
Yeah, for sure. So first of all, the history of copper peptides in the world of hair restoration, for me, in my practice at Bauman Medical, goes back to 1999.
Nice.
When we were doing more invasive types of procedures, we used copper GHK, that's copper tripeptide, as a wound healing agent. And so we used to dispense to every single patient a kit. It was basically looked like a toiletry kit, but it had gauze that was soaked in the copper peptide that they would use on their scalp. It had gel for the old-fashioned linear scars that we were harvesting with, and also sprays that you would spray on the scalp in that immediate post-operative phase. And so copper tripeptide had a lot of research for skin rejuvenation and skin repair. And so we were using that for a long, long time. And then it kind of faded away a little bit as we got into the more minimally invasive style of transplants, no scalpel, no stitch, single follicle and follicular unit extraction process. We didn't need as much in those, as we moved to that technology in terms of wound healing. We stopped doing our hyperbaric so often, things like that, only special cases. So But today, what we were talking about just prior to getting on the show is a technology called TED. And so TED stands for transepidermal delivery. And this is a brand new technology that was developed in Israel, studied overseas, released in the US in stealth mode, and researched in Chicago for maybe 2 years, even during the pandemic, in hundreds and hundreds of patients. And what they found is that the use of ultrasonic delivery system, this ultrasound delivery device, if you will, disrupts the stratum corneum at the level of the skin. And so the stratum corneum is that moisture barrier of the skin. It's a very small layer, but it's the reason why you can get out of the shower and not look like a sponge. It basically,
it's important.
Like all blown out. Right? So it takes a while for that to happen. You have to be in the shower for a while, or in the Hudson River, as they say in the old days.
Yeah.
But the point is that moisture barrier is like, it's almost like a brick and mortar. So it has the cells and the lipid layers that are really, really tight. And so it blocks the absorption of anything you want to try to put medication on, peptides, whatever. Everything that you put on the top of your skin is basically being blocked mostly by that stratum corneum. But so ultrasonic sound waves, which are painless, by the way, these high frequency sound waves basically sounds a little bit like a jewelry cleaner. If you've ever used a jewelry cleaner, or for those who have ultrasonic toothbrushes, you hear that kind of almost like a ringing. That's what ultrasonic delivery is like. And what we do is we apply that to the skin to disrupt the stratum corneum, and then we use a serum that comes with the device and drive it in.
Okay.
And so everybody wants to know, when that first technology came out and their hair growth results were being presented at the American Academy of Dermatology. And I spoke to one of the original researchers, Dr. Lady Di, up in Chicago, and got some feedback from her patients. And what everybody wanted to know, well, what's in the serum? Because that's what everybody,
what's the magic juice?
What's the magic juice? And so we did a deep dive into it, and it contained copper peptide. It contained a thymosin beta 4 derivative, which we know is great for hair growth. It also has VEGF and fibroblast growth factor. So it has a lot of growth factors, a lot of peptides in there. And I think the magic answer to your question is getting it down into the skin.
Right.
And so if you could do that without a needle, hey, that's awesome. And so that's TED. So TED hair restoration treatment is transepidermal delivery with ultrasonic waves of sound. Patients will come in for that treatment 3 times, separated by a month. So every month for 3 months. And the treatment has no downtime, no recovery period whatsoever. It takes about 30 to 40 minutes, depending on the length of your hair. And we're getting hair growth from that, and decreased shedding.
Wow.
So it's really, really interesting. The data is still coming out. We don't have all the answers. We don't know how long it lasts yet, like we do for our PRP.
Or like you might need to repeat it or something. Yeah.
So we're at the very early stage of this super exciting technology. This is going to be a game changer for the industry for sure.
Yeah. Well, because I guess the other way to disrupt the stratum corneum, which is what people more commonly use, which is more invasive and unpleasant, it would be like microneedling, right? Because you get a lot of products out there require microneedling, which of course, if you don't have hair is one thing to do a roller, but otherwise you kind of have to use I've seen a stamp being used, because you start rolling things through your hair and you're going to pull your hair out. You're going to pull out the good guys to save the other guys. So.
Correct. So, I mean, we demonstrated the TED device at the Biohacking conference. We were running that thing all day long. Dave got his TED treatment while we were there. But when I gave the presentation on biohacking baldness, questions came up regarding microneedling. And microneedling does work. It's just, it can be tricky to do it on your own. Exactly like what you said. Is the roller going to get caught in your hair? Are you using the correct depth? And so when we do microneedling, we do it with a professional device. And so there's a true medical device, not something you're going to buy on Amazon or get some from China or whatever. This is a device that's specifically made for microneedling the skin. It has a fine-tuned adjustment for depth. It has a hermetically sealed cartridge that's one-time use, disposable, so it's sharp and just sterile. You don't have to worry about cleaning it and all that business. And then we do that at the very end of our PRP treatments.
Okay.
So after we've done our injections with our PRP, I mean, we're skipping around a little bit, but after we do our injections and do our business with PRP, we actually use another growth factor serum with microneedling as the finisher of our PRP treatment.
Nice.
Yeah, but I caution patients to do that at home. Please be careful with anything sharp on your skin. Because if you create too much trauma, too much damage, I mean, don't go to, the craziest things you'll see on YouTube, right? I mean, the guys are bleeding all over the place. It's like, oh my God. So try not to do that, because too much inflammation is going to cause a lot of loss there.
Yeah.
So be careful,
And you can almost, I've heard, like, you can almost, I mean, I've spoken to even dermatologists who don't love these home microneedling devices, because they're like, you're tearing the skin. You're going beyond the micro trauma into trauma. And so now there's, you're going to build collagen, but you're going to end up with some scars or God knows what else.
So it's not just the penetration of the serum, I guess, is the point, but also that little tiny micro trauma that you're providing to the skin with the microneedling device that's triggering the repair. But there's a sweet spot. If you do too little, you don't get that response. If you get the proper endpoint, which is, that little bit of redness in the skin, maybe with the microscope, you can see a little bit of punctate bleeding, but not a lot. If you go overboard and you're ripping or tearing the skin, then you're going to into the damage category, and you're going to have the opposite of the effect that you want.
Yeah.
Not a good plan. No. So that's why we always recommend microneedling under microscopic magnification with these sophisticated tools that are sterile, that are finely tuned to exactly your skin depth that you need.
Yeah.
And an operator who understands how to do that. So remember, your operator for your skin, for your face in the Medi Spa may not necessarily be a good operator for your scalp either.
No,
so, there's a difference there. And the scalp treatment folks are very highly trained. Like I have a full-time certified trichologist and anesthetician, and my other team members, a PA and an NP. And so these folks are all highly trained as to what to do for the scalp. That's different from what to do for the skin.
Yeah, no, for sure. Okay, so let's back up a little. Like, we're going to kind of do a little backup, and then we're coming back. So because we talked about women and the causes for hair loss for women. Let's move over to the men now. Everybody knows male pattern baldness. We know that, in some men, they convert their testosterone to DHT. There's a sensitivity in the follicle dies, the hair goes, and boom, there you go. You end up with like that baldness at the top and the crown of hair.
Good job, Natalie. You got it all covered. That's it.
Well, no, I got that one. But what are you seeing for men also? Like what else are you seeing in the guys' world?
So your description is 100% right. It's the sensitivity to DHT that you inherit, and how fast you lose your hair is dependent on that sensitivity and the levels of DHT. So we see it. It can happen anytime after puberty, your receding hairline, thinning in the crown. Once the follicle is miniaturizing, time is ticking, right? So we say time is follicles, because if you don't act at the earliest possible time, the follicle gets into a phase where it's so degenerated that it's beyond repair. And so there's a certain hair caliber and length that tells us that the follicle just cannot rejuvenate. And we look at that under the microscope. We have AI powered microscopes that actually can tell us the exact hair density in the area. It quantifies how many hairs are in a certain category of thickness, 90 microns and over, 60 to 90, 30 to 60, less than 30 microns. Those are categorizations of how healthy that hair fiber is. And that we can infer from that how healthy the hair follicle is. So we do those diagnostics, and then we figure out, well, what are the therapies that we need? Anti-androgen therapy is still the mainstay of therapy. So every male converts testosterone to DHT. And DHT being the bad guy, anti-androgen therapy is still the mainstay of treatment. So treatments like finasteride or stronger therapies like dutasteride, which may be the strongest treatment that we have for male pattern baldness, are very commonly discussed first. But even though they have amazing benefit, there's also some risk.
Yeah, like doesn't that affect their physical, the physical need for testosterone?
Well, let's.
Or is it just blocking the conversion of testosterone to DHT, or is it?
Yes.
Okay.
Yes. So testosterone is converted to DHT by 5-alpha reductase enzyme, and there are 3 types now. We know the type 2 type is kind of the main road to DHT. It's like the superhighway, and that's what finasteride blocks. So if you take finasteride, you're inhibiting the enzyme that's producing the DHT, and your DHT levels in the serum go down about 60% on average.
Okay.
And that's enough to produce 90% success in patients. So 90% of men on finasteride will have a positive result. That means what? That means that 2 out of 3 are get some regrowth, and 5 out of 6 are going to basically stop losing hair for the long run.
Okay.
That's pretty good numbers.
What's the downside?
Downside is and also we know that it doesn't affect the regular testosterone levels. In fact, testosterone can actually bump
Go
up
up.
a little bit because you're blocking that breakdown. But lowering the DHT has an effect on the sexual functioning in men in 2% of patients. And so decreased libido, sex drive, and difficulty maintaining a hard erection, mild ED can occur 2% of the time. Oh, and decreased ejaculate volume as well. So what happens if that occurs? Well, the good news is that you can stop the medication, and the medication is going to be out of your system in a week. And so theoretically, you should be able to rebound from that pretty quickly, and then decide from there, what do we need to do if you're one in the unlucky group there. But 98% of folks have no reported side effects, and they do very, very well on the medication.
Wow. And this is oral finasteride? This is systemic, right? Because is there not a topical? Yeah, sorry.
Well, let's talk about that. So the FDA approved version is the oral version. That's about it's a milligram. That's the FDA approved version. With compounding pharmacy, we can change that dose. So if you happen to be super sensitive to a milligram, we can change the frequency of the dose, of course, but also the quantity. So we can lower it, take it less frequently. But we can also now compound it into a topical version. So topical finasteride is available, which works almost, in my opinion, almost as good as the oral version. And we combine that with minoxidil, which is the other FDA-approved medication. So that's a nice option for folks who want to avoid the risk of systemic side effects. It virtually eliminates the risk of systemic side effects when you do it topically.
Okay.
Because you're getting so little into the system. You're just targeting the follicle directly now.
That's so interesting. So what population do you think that's most appropriate for? Is that like for your younger population? Like, because there's probably different types of male pattern baldness. You've got the very aggressive one that hits youth, like the young guys. And then you also, I'm imagining that as men age, like women, they might start to see thinning of hair later on down the road. Or is that just a less aggressive form of the same thing?
Yeah, I mean, for the vast majority of patients, it's a continuum, right? And so, as I said before, it could start right after puberty, and you could be graduating high school with a thinning spot in your crown. That's not so good. So early treatment is the best treatment. Now, is every young patient ideal for finasteride? Maybe not. Could we use those topical minoxidils? Could we use red light therapy, laser light therapy, or PRP treatments? Sometimes in those early stages, if you're not really sure if it's a maturing of the hairline or male pattern baldness, we would choose a non-chemical therapy. And treatments like PRP and laser therapy or photobiomodulation are very nice options.
Nice.
And we can track those patients very carefully. So the younger patient, obviously the opportunity is to protect their hair. So we want to be aggressive in doing something.
Yeah.
And then the question is, well, what is that something? And let's look at the risks and benefits. I have young patients on finasteride. I have old patients on finasteride. So it's a personalized one-on-one decision that we make to determine whether that medication is right for you. And if not, that's okay.
Yeah.
I got other tools in the toolbox. We can use TED. So we can use transepidermal delivery of peptides, get some hair regrowth, maintenance and such. You know, we can do PRP treatments, which in my practice last about a year or so. So those are ways to really maintain the existing function of the follicles over time without dealing with the systemic side effects of medications.
Yeah, no, that's so interesting, because I've always thought that the minoxidil and finasteride just had terrible side effects. So I guess it depends on, again, you're saying what pretty much anybody in the biohacking kind of functional medicine space is going to say. It depends. Like different people respond differently to the same treatment. And in the end, you're just sitting there trying to sort out what the best path is for each individual.
Absolutely. And I think most people kind of run into trouble with the traditional minoxidils. So if we're talking about the other FDA-approved drug, minoxidil is a direct stimulator of hair growth and increasing blood flow. Most people think about Rogaine or generic medication like that. That's over the counter. They're getting it at their supermarket or pharmacy. And that's usually kind of a greasy, gooey mess or foamy mess. It just doesn't really get onto the scalp so easily, and it impairs the hairstyling. So there's compounded versions of that we prescribe that are going to be not gooey, not greasy. Like 82M is a great formula. That's a non-gooey, non-residue prescription formula of minoxidil plus tretinoin, which is an enhancing agent. And so sometimes we'll do genetic testing to figure out, are you a good candidate for finasteride, or do we have to use something even stronger? We have to consider dutasteride, which I was mentioning, the type 2 5-alpha reductase pathway, right? that type 2 is kind of that super highway to DHT that we want to block with finasteride. Well, there's another kind of service road that swoops around, if you catch my analogy, that also makes DHT, and that's the type 1 5-alpha reductase, which is more prominent in the scalp, actually. And the other medication, dutasteride, blocks both of those.
Wow. That's really
so it's stronger. There's a little bit more risk, and we can talk about that, but sometimes we do that.
So what do you mean by risk? Because is it a topical again, or is it just so much stronger that it gets in?
So dutasteride is not FDA approved for hair loss in this country, although it is approved in Japan and South Korea. Dutasteride is approved for prostate enlargement, has a similar mechanism of finasteride, just works stronger. So if you take that medication, you're going to lower the DHT down 90%, much farther than with just the finasteride alone. But side effects almost double. So they go from 1.8% to 4.8%. And the other issue is that dutasteride, if you're taking it orally and you've developed a steady state, let's say, it could take weeks to get out of your system because of the long half-life. So some people are concerned about that. But that also might be beneficial to some patients, because that means maybe once you're at steady state, you don't need to take it every day. You can actually take it in less frequent dosages. And so there's a lot of discussion in the world of hair restoration. Should I be taking dutasteride? At what dose? Should I be taking it with finasteride overlapping if I'm transitioning? Because it's going to take some time to build up in the system, just like it would take some time to come out of the system.
Right.
And then should I be taking it once a week, twice a week, 3 times a week, daily? So there's a lot of questions.
Yeah.
And so patients always ask, like, well, how do we figure this out? Well, the answer is treat, track, and monitor. And that's one of the things that we do very well at Bauman Medical, is that we're doing so many different measurements. We can tell exactly how your treatments are working given enough time. So we start an intervention. In 90 days, we'll come back and repeat the measurements. And so we're not waiting for your hair to grow out. That takes a whole year. We're going to know in quick order, within 90 days, we're going to know what's working and where and how much.
Yeah. And what's not, like what you're trying to mitigate. So, okay. So back to the reasons why boys lose hair. So then beyond that, it's going to be pretty much the same list as women. I mean, other than childbirth.
Correct. Yeah. That would be interesting.
Having a new baby in the house can disrupt your sleep and your diet and your lifestyle. So maybe could make you stressed, but.
And, we're in a brave new world. So, I think men can have babies now, I think, according to the, those folks.
I must be getting old, because some of that stuff is getting to me.
Understood. So, but, there are risk factors, right? So for young men, things that boost testosterone, like even just heavy workouts, like a lot of our athletes are doing strength training. They may be supplementing with creatine. These are things that are known to boost natural testosterone levels. And creatine was tied down through a bunch of, actually a couple clinical trials to increase DHT levels.
No way.
Yeah. So, we have to talk to our athletes or junior athletes or college athletes about, what are the things that they're putting in their body that could be affecting their hair, and is it worth it? And that's again, another personal decision. Do you want to stop your creatine, which maybe you're getting some good effects from, and pumping out and, in the gym, but it's also knocking out your hair.
Yeah. Like, well, it's, at the end of the day, it's number one, what's the goal? And I think, there was a post in my community recently by a woman whose 16 or 17-year-old son wanted to know what supplements he could use to grow his muscles bigger and faster. And, the answer that came from me, and actually, interestingly, from the overwhelming majority of the community, was, at that age, you don't need anything. You need to eat the right diet. You need to get your butt into the gym. You need a decent routine.
Yeah.
You don't
totally.
Maybe a whey protein shake. Your hormone. Call me back. Who's that?
I mean, my 19-year-old, this past year put on like 30 pounds of pure muscle just by hitting the gym. Without any extra. Well, he had to eat a little bit more, but without any extra supplementation or anything. So you're right. I mean, that's the average 50-year-old is not going to be able to do that.
No,
it's impossible.
Yeah.
So lifestyle and nutrition and all of that is important for men too, and there's obvious risk factors. I mean, your audience are not smokers and such, but, smoking is terrible for that vasoconstriction of the scalp. And so often we see that related to hair loss.
That's interesting.
But there's medications that can trigger hair loss as well. And in a younger age category, it could be Accutane. There's a
Oh,
lot of hair
okay.
loss associated with it, for acne, obviously. And then, as we get older, people are on blood pressure medication. They're going to be on perhaps a statin medication. They might be on a mood modulator. I mean, we're talking about the general public here, maybe not, again, the biohacking audience, but, in my practice, I see a lot of patients that come in who are on a statin, a blood pressure medication. They're on mood modulators,
Yeah, it's
and
crazy.
all of those things are terrible for your hair. They're just awful.
That's so interesting. And that's so, I mean, it's so sad, right? Because and especially like the mood modulators, when they're used as the first line of defense, like, there's a place, I think, for almost any medication out there. But unfortunately, it gets used as the only strategy, and people just lean on these things so heavily and then just,
Well, they're
not,
not, again, it's the same problem with hair. They're not finding a specialist. I mean, if you're talking
yeah,
to your primary care doctor about depression, his knee-jerk reaction is, oh, you need to be on this, blah, blah, blah,
yeah,
and he's putting you on an antidepressant like before you even walk out the door. He didn't discuss anything with you about your sleep or your activity level or your aspirations or what have you. It's just like going to a dermatologist for your hair loss. They're not going to do a deep dive. They're not
yeah.
even going to measure your hair. They'll look at you sometime from across the room and think, oh, yeah, you're fine. And that happens to so many of my women that come in through the practice. They're like basically dismissed
Yeah.
by their local dermatologist. And it's like, they're like almost shoot out the door. Like, what are you complaining about? That's
Yeah,
terrible,
it is.
because hair is an important item in terms of our emotion, how we look at and how we feel are very, very closely tied to our hair and our skin and things like that. Oh, I was going to say that as the patients age, let's say into their 30s, 40s, and 50s, then as their natural testosterone levels are declining, today there are things that we're doing to replace or optimize hormone levels. So very often, if you're overdoing it with testosterone replacement, and this can happen in women as well, whether it be with pellets or injections or creams or things, you could boost up that testosterone, and now it's accelerating conversion to DHT. You can be triggering some hair loss.
Yeah.
And so I have female patients postmenopausal who are on hormone replacement therapy with pellets. They've been, overdone, let's say what we call stacked with testosterone pellets, and it aggressively destroyed their hair.
Yeah.
And we have to kind of just wait for those pellets to dissolve
Yeah, the
in the
pellets
body.
are a disaster. Yeah.
Well, I mean, again, there's some nuance, like with
Yeah, for
anything,
sure.
right? And so for some people who can't give themselves injections or do creams or things like that, a pellet is a very, very nice way to replace hormones. But you've got to do it carefully. You can't overstack it. Or let's have a discussion with that patient, or let's measure their hair before they go on hormone optimization
Right.
therapy.
Right.
And the men too, they don't realize that, they're talking to their HRT doctor and, yeah, juice it up, let's go. And there's no upper limit. And then we hear that at the conferences all the time, and that's all fine and good. And for maybe, 90% of folks, it's okay. But there's a percentage of people who are going to be super sensitive to that little bit of extra DHT, and it's going to knock their hair right out. And so
For sure.
a lot of men come in, in that age category and say, you know what, this hair loss really started when I started my hormone optimization therapy.
Yeah.
And so at Bauman Medical, there's a lot that we can do to help protect the hair during those times in our lives where we may opt for some kind of optimization, whether it's nutraceutically or pharmacologically.
Yeah, no, and that's so interesting. But I mean, what you keep saying over and over again, which is so true, it's finding the sweet spot. What I meant by the pellets that are a disaster is I've just seen a lot of people who maybe they didn't get assessed properly, they overdo it, and now you're stuck. Like you're stuck for the life of the pellet, and it just takes away any. It's almost like people should be if in an ideal world you use a different strategy until you figure out the dosages, and then you move to the pellet, which makes it easier from at a consumer level. So let's as we said before this podcast, we could film any podcast today, but let's talk a couple more of the innovative strategies that you use in your clinic. I think a lot of people have like the regenerative stuff, like the PRP, the stem cells. We talked about PDO grow.
We didn't talk about that yet.
No, we didn't. So no, we talked about it before.
Yeah,
that's what I mean.
Right.
We want to let everybody else in on on that stuff.
Yeah, so probably one of the largest areas of expansion in terms of knowledge and research, and also therapeutics in the world of hair restoration, is in regenerative medicine. And this is something that we saw starting 15 years ago, really when the orthopedic surgeons started to do stem cell therapy for joints and things like that instead of surgery right off the bat. And my background is general surgery, and many of my friends are orthopedic surgeons. And I learned really the basics of regenerative medicine from them. I learned about cells and signals and scaffolds and things like that. Those are concepts that if you don't know those concepts, you can't apply the technology appropriately. And of course, in the beginning, we didn't really know how well PRP was working. We didn't know really how we should be creating the PRP. And sometimes we trusted those folks who were basically the vendors who had the devices and the kits. And that's unfortunate, but we did learn. Okay, so 15 to 18 years later, we're 12,000 PRP treatments into this process. So now we kind of know that there's a dosing strategy. Go figure. So create so that it makes a difference how you make the PRP. You can't just put it in a test tube and then sit it in a salad spinner. That's not going to work. Not for hair.
No.
Okay. That might work for skin and actually some for wound healing, because there are properties in platelet poor plasma that do accelerate wound healing. And they've seen that, or low dose platelets, which would be like 1 to 2 times concentration. But for hair growth, for stem cell mobilization, for new blood vessel formation, the data and the research is absolutely clear. You need 1.5 billion platelets per cc. That's 1.5 million platelets per microliter. And so how do you know? Well, you've got to measure it. So our PRP treatments are done with a large blood draw. And when I mean large, it's just 1 syringe, but it's not a little test tube. Sorry. It's going to be a little bit more. Feels the same as 1 test tube, so you don't have to worry.
Just don't look. You'll be fine.
Yeah, exactly. And it's not a big deal, to be honest. And then that gets separated in a dual spin PRP process. So that's one of the critical steps. Getting rid of the red blood cells first before you start to separate out platelets. And that's what helps preserve the platelet concentration. So our final PRP is going to have maybe 6 to 8 times concentrate of what your normal blood level of platelets were. So that's going to be that sweet spot, 1.4 to 1.6 million per microliter, which is really where we want to be. And we have enough of it, hopefully 7.5 cc's worth, to inject the scalp. And we're going to do that comfortably. So you're going to have a ring block of local anesthetic, which takes just a few minutes. That's comfortably applied while you're sucking on the nitrous oxide if you want, up to you.
Yeah.
So it's a real comfortable process. It takes about an hour. And we're going to do that procedure to process the PRP. We're going to add some kind of scaffold to it, whether it be a biologic scaffold, like a perinatal biologic material from years ago, or more frequently today, we're going to use PDO, polydioxanone, which are the little tiny threads in the scalp. That's a synthetic scaffold. So that potentiates.
So that's like a physical.
PRP.
That's a physical, like when you say scaffold, this is not like a theoretical term. This is like a physical something for those platelets to kind of hang on to, kind of thing.
Yeah, your body is going to work on scaffold. So think of scaffold like in the most largest sense. Like if you had a hernia repair and they had to put a mesh, to hold to hold the hernia in. Well, the mesh is a scaffold that the body is going to hopefully reabsorb over time and turn into natural biologic tissue. Yeah. And so the scaffolds that we use today are basically derivatives of those same types of slow absorbing suture materials that were available and FDA cleared probably like 40 years ago. So you may have heard, or your audience may have heard, about the use of little tiny threads into the skin to stimulate collagen and things like that. Practitioners sometimes, compare that to surgery. Obviously, it's not going to have the same effect as surgery. But anyway, the point is that those threads do something. They have a biologic effect. In the skin, they generate collagen, the new blood vessel formation, release of growth factors. The skin looks better. No question about that. So why is that? It's the growth factors that are being released in that zone to anti-age and regenerate the skin. So that's a scaffold that we place in under the skin called polydioxanone in a process that includes the PRP. So PRP plus PDO, that's called PDO Grow. And I was the first to do that in the United States. I didn't invent it. I learned about it through my colleagues from the Far East who said, hey, you may want to take a look at this. I was pretty skeptical. I did some of the research. I looked at the clinical trials. I found some colleagues over there in India and South Korea who were doing it. And I said, hey, is this working? And show me how to do it. We learned it. We did it. We did it for the first time in the US about 6 years ago.
Wow. Yeah. So that's
So
your level 2 PRP that you were talking about, taking PRP
yeah,
to the next level, basically.
correct. So our basic PRP is pretty darn good. We get about a 30% improvement in hair mass over the course of about 10 to 14 months. And we can get, with the use of the PDO, the threads, we get about a 20 to 50% improvement over that, and a 20 to 50% improvement in the duration of the length of the effect. So not only just a year, but maybe even up to 2 years in some cases
Wow.
to get the hair growths, which is really nice. But those treatments have to be repeated over time, and everybody's different because
Uh-huh.
everybody's hair loss is different, and all your risk factors and genetics are different. So it's a
Yeah, so I was just thinking, like, so for these different treatments, obviously you have different populations that this is going to be appropriate for. Like somebody who's got a problem, a DHT problem, which is a systemic issue with the body essentially attacking the hair
mhm.
follicle. You can't just do like a PRP level 2 or level 10 on its own, because isn't the body just going to go with the hair follicle anyway?
Well, what's interesting is that many of these treatments that don't influence the DHT are very powerful. I mean, look, just think about minoxidil for a moment. We don't have to get
Yeah.
crazy with the regenerative treatments, but minoxidil is a very powerful hair growth treatment that, when it's applied either topically or orally or both, can really diminish the effects of that DHT. So if you
Mm,
push hard enough on the follicle, you can overcome that negative influence,
interesting. Okay.
with some exceptions, but there are some patients that need to address the DHT. Look, if you take out the most powerful treatment out of your toolbox, right? So male pattern hair loss, young guy, aggressive hair loss, and we say, no, we don't want to use finasteride. Well, then we better be ready to really apply a variety of other therapies, because, we're not affecting the DHT.
Okay. So you've just
Or
you
we've
got
got to
okay.
figure out, maybe a nutritional supplement like a saw palmetto supplement, a very good quality saw palmetto can work similar to that finasteride without the systemic side effects.
Right. So by blocking the alpha,
Yeah.
right.
So it is possible, to address androgenetic alopecia without working with anti-androgen therapy. It's just a much tougher battle. It's a much steeper hill to climb.
Yeah. No, I get
You
it.
got to
Well,
bring some friends, is what we
you got
should
to
say.
bring you got to bring in the big guns.
Yeah, bring in the
Um,
soldiers, bring in the army, bring in the troops.
yeah, no kidding. So you mentioned something earlier, and I think the people with the sharp ears will have picked up on it and be curious about this, and that's nitric oxide and the
Mm,
and the role of nitric oxide and how you're using it and integrating it into your different therapies. And I remember well, I was sitting next to Nathan Bryan at the Biohacking University, and I know you guys were chatting, and so he's making supplements that are systemic that improve the body's production, if you will, of nitric
mhm.
oxide.
Yep.
But you talked about it as people in inhaling nitric oxide while waiting for their freeze, or not.
No, two different things. Two
Okay.
different things. So nitrous oxide is the anesthetic. So
Oh,
that's the anesthesia that you take. So nitrous oxide, you
yeah, yeah,
breathe
yeah.
it, and that's the old, like when you're in high school, maybe your friends did whippets. It's
Right.
also what anesthesiologists use to knock you out.
Okay.
In the office, nitrous oxide is used for patient comfort and as an anxiolytic, which basically reduces your anxiety, right?
Got it.
So that's completely different molecule
No kidding.
than
Yeah.
nitric oxide. Nitric oxide is a gas. It's also a gas. It's a signaling molecule in the body, and it's used by mitochondria. It's used to kill invaders, infections, and parasites. And it's also used to dilate blood vessels.
Hmm.
And Nathan and I go back a number of years through the A4M, and of course nitric oxide, as your audience knows, is a Nobel Prize winning discovery, and its relationship to cardiovascular medicine, I mean, is groundbreaking, and one of the most important discoveries for cardiovascular medicine, in the history of medicine, I think. And
Yeah.
we know that without blood flow, you're not going to get organ function.
Hmm.
And you're not going to get wound healing. And so as a surgeon, I'm a little bit selfish. I want your wounds to heal, right? And so even if we apply hyperbaric oxygen, well, if the blood flow to that area is not so good, it can be very difficult to heal that area, even with adjunctive hyperbaric oxygen. So getting blood flow to any wound, to any organ, to any follicle, in my opinion, is critical for hair growth. And so I'm a big advocate of nitric oxide and nitric oxide replacement, because I feel like there are a number of different things that are affecting our nitrogen intake and the use of nitrogen in our bodies. And as I don't have to give you the nitric oxide lecture. You can probably go listen to Dr. Brian explain it better, but we know that mouthwash and dysregulation of our oral microbiome disrupts that nitrogen cycle. We know that low acid pH in the low amount of acid in the stomach can disrupt the absorption of nitrogen and that cycle. And so there's
even genetics.
And genetically, sure. And age, obviously, also, and how much we take in, physically, as we eat, how many, beetroot vegetables and leafy greens, spinach, can Popeye eat, and why did he eat all that? So, all of those things that your grandmother told you are turning out to be true. You should eat your vegetables, right? I always get in a fight with my family because I love beets and nobody else does. So,
that's so fun. I love beets too. Yeah.
But anyway, so what we do in the practice is the following. So I have a very strong nitric oxide protocol. We test every patient at the time that they come in. It's a signaling molecule which helps mitochondria. So if you're going to do laser therapy, you might want to test your nitric oxide level. Mitochondria also, as they improve, they're going to draw a lot of blood flow. So you want to make sure, like if you're using laser light therapy to the scalp, I always feel this pulsation when I do laser light therapy, and I feel it's stronger when I'm doing the nitric oxide supplementation. So we can test nitric oxide in 10 seconds, as you know, you swab the tongue and you push it together and boom, it tells you whether you're depleted or not. There's lozenges, there's capsules, and also in the practice, there's also powders. Yeah. And then in the practice, we've used for actually a number of years now, nitric oxide releasing gel. And so this is a two pump gel. It's got 2 chambers. You squeeze it out and that activates and releases nitric oxide right at the level of the skin. So we've been using that in our hair transplant patients. And I think it's having a very strong effect on blood flow in those areas and really accelerating wound healing.
Interesting. I use that on my face.
Yeah. So I have a family member who I will not identify, who he had some acne and had an amazing response from the nitric oxide.
Yeah, no, it's remarkable, right? And I mean, they talk about how it improves because it vasodilates the microvasculature in the face, it's going to improve the penetration. It's not quite as powerful as disrupting the stratus corneum, but it will improve the absorption of all those expensive serums and gels and whatnot that we apply.
Oh yeah. Yeah, no, I think it's important. And, as I said, every follicle has its own blood supply.
Yeah,
so, and that's all microvasculature. So if we can dilate the blood vessels and enhance that, whether it be, again, multi-targeting, right? Multi-therapy. So you've got laser light, red light therapy, which hits the mitochondria. You've got minoxidil, either topically or systemically, to dilate the blood vessels. And then you've got the nitric oxide to respond, to make those blood vessels dilate even further. I think you're going to find improved hair growth. And that's what we've been seeing in our practice. So it's a really, really nice adjunct in the nutritional realm. And it's pretty exciting stuff.
Amazing. Well, I kind of want to ask you about mitochondria and red light and all that. And
yeah,
we're coming up on time. So let's make that our last topic.
Okay.
Even though there's 27 other ones we could go at, but let's talk about mitochondria, lasers, and red light.
For sure. So red light therapy and laser light is on tips of every biohacker's tongue these days, because you see it all over the place, and they're lasering everything, lighting up everything, as you know, from head to toe, right? And everything in between. But in the practice, I've used laser light since 1998. It was the guy that originally sold me my first microscope for the scalp. And he said, hey, in Europe, they're using light therapy for hair growth. I said, and he said, you need a laser. I said, well, I'm not doing laser hair removal. He says, no, hair growth.
Yeah.
And I was like, I don't know what you're talking about. And I honestly told him, I don't think that's going to work. And so I was a big skeptic. He did lend me the device. It was a huge, big device that kind of came down over the patient's head and turned almost like a big hair dryer. I mean, it was
my God. Yeah.
Expensive device imported from Sweden. And I was determined to show that it didn't do anything. But I'll tell you, the more patients we put under that and the more we put them under it, the more hair growth we were seeing. And it was just unbelievable. And, to be honest, my colleagues didn't believe it either. And even after the data came out with the small handheld devices, they still didn't believe it. So it is what it is. Today, we've got double-blind randomized meta-analysis review studies that show red light therapy, it grows hair. So it's not a question. If you don't believe the meta-analysis, then that's a personal problem. That's
you have a problem.
I can't fix that for you. So, that's like the strongest level of research analysis that you can have in the world, that we know. That's the ultimate level. It's not like one little, case report. Okay.
Yeah, exactly.
And so we use red light therapy because, and again, in the early days, we didn't know the mechanism, but today, Dr. Michael Hamblin, the most well-published, most well-researched researcher in the world of photobiomodulation, has detailed it out for us. So we know red light therapy hits the mitochondria at the electron transport chain. It's converted by the cytochrome C oxidase. That's the photoacceptor molecule that accepts the photons, and some techno wizardry occurs and you get ATP. And that's how that works. So, but actually there's, hundreds and hundreds of modulated gene expression that occurs in the nucleus in response to red light therapy. And it's a powerful treatment for wound healing, anti-inflammatory therapy, as well as a hair growth treatment. But I've got some caveats for you. Your regular LEDs that you see out there in the general marketplace are probably not powerful enough for hair growth. So it's the same thing as PRP. The weak PRP that's working for skin is not enough for hair, maybe not. And so we need a stronger PRP for hair. Same thing with laser light therapy for the scalp. And so when we took the laser cap and we redesigned it as the turbo laser cap, the Bauman turbo laser, we put over 300 diodes in it. We made it pack completely flat for travel, so you never leave home without it. And we made it treat from the hairline all the way through to the nape hairline in the back of the neck. So we could use it for wound healing and hair growth in all patients and for all comers. Size adjustable, portable, battery pack powered. That is the ultimate device. Even though in the office we still use the
hair dryer
format. Yeah, no, we don't use the hair dryer. That was from 25 years ago. But we have other panel devices that are, stationary before and after hair transplants, before and after any regenerative treatment, PRP included, before and after all visits that patients come in for wound healing post-operatively until they're healed completely, before and after TED treatments, the transepidermal delivery. So very, very popular laser light devices that we have in the practice. They're running all day long. They've got 100,000 miles on it and they're still going strong.
I'll bet.
But
then the cap, but then the cap is something someone can take home. Like they can buy it from you and use it on a daily basis.
Correct. Now be prepared. This is not the same price range as what you're going to get on Amazon. Okay. This is a medical device. FDA cleared for hair regrowth, so we're clear. More diodes, more power than any other device on the market, more coverage and so forth. So, for folks who are looking at the beauty budget, a typical device that you're going to find for red light or laser light on your scalp is going to be in the $1,000 range or maybe less. A medical grade laser is going to be in the $3,000 to $5,000 category. And as you get into the top end, you get all those features. But look for one that has a lifetime warranty where, obviously the manufacturer or the practice will stand behind it forever. Hopefully it's the last one that you need. And if you calculate that over the course of time, you'll find that may be one of your least expensive treatments to amortize the cost.
For sure. Yeah. Well, especially for someone, it's one thing if you have an autoimmune condition, you get that under control, you resolve the hair, you may not have to have ongoing treatments. And yet for some of the other conditions we talked about today, this is a lifelong journey. Actually,
correct.
I guess
and the turbo laser, just to add in, Dave Asprey said it has more lasers than anything else he's ever seen in his life. That's what he told me. And so he loves it. Dr. Lana uses hers. She loves hers. And so Dave also healed faster and grew faster than any other patient in my practice in 25 years. And I've done over 13,000 surgeries. So, he knows how to hack the healing process, and red light was part of that, as well as this hair growth process.
Yeah. So it's not just a question of like putting your head down in front of your panel. You're going to need something a little more.
Great. Yes.
I mean, it'll help. I'm sure it's not a bad thing, but it's not going to give you the same results as a cap.
Yeah. Patients ask all the time, is my Juve going to do it? Is it blah, blah, blah. And the bottom line is that there's a little bit of power there, but if you measured it, you're going to find that's just a trickle compared to what you really need.
Yeah.
So there's a certain amount of joules per centimeter squared, which is a measure of energy that the cap delivers. And the cap is finely tuned by a team of engineers to deliver that adequate dose, the super dose, if you will, to get the hair growth going. And I'm very, very confident. There's no other laser hair growth company in the world that has a physician at the head of it. That's Dr. Michael Rabin, and his advisors, who are engineers from MIT, Dr. Hamblin from Harvard and Mass General, and the Photomedicine Center, Wellman Photomedicine Center. I mean, it's just, there's no other team, as well as the feedback from having used laser therapy for 25 years in the practice.
Yeah,
So,
the dream team.
It's a great device.
Yeah, no, it sounds like an amazing device. It sounds like, it sounds like an investment, right? It's like so many things in the biohacking space. It's when you get into the better quality stuff, you're investing in your future, in your health, and it should give you many, many years of great service. So I know I said the last question, but about the cap, does it hit the brain at all?
So
does it go through the,
so the red wavelengths, 630, 650, 670 nanometers don't penetrate all that well through bone, to be honest.
Oh, perfect. Okay.
But remember that red light therapy, and Dr. Hamblin did this research. This is the treatment that's used in stroke victims and TBI patients to improve blood flow. So some patients find that it's a relaxing effect when they use the red light. Now, I don't know if that's from visualizing the red light or if they're getting some kind of brain effect. I'm always doing it at night before bed, so I'm hopefully getting both benefits there.
Yeah, yeah.
I always shine the laser on the back of my finger just to kind of see that how far it goes, and you can kind of see how far that red light does penetrate. And certainly the follicle is only a couple of millimeters under the skin. It extends from the skin surface down at a maximum about 5 to 6 millimeters at the most, and usually it's half of that.
Okay.
Because they're on an angle. So you're really hitting a lot of hair follicles when you do a red light therapy over the top of the head. Like that. But I think for brain function, you need to go to Dr. Weber. He's from Germany, and he makes some nice devices. I think also the Wavi people who do the portable EEGs are also making a photobiomodulation device. And just a quick plug for my hobby. We take care of military veterans at Gray Team. It's a 501c3 here in Boca Raton, Florida. And those folks who have had TBI or risk for PTSD related suicide do get great benefits from transcranial photobiomodulation. So they're using these helmets, and we're documenting the results of those treatments through research with Florida Atlantic University right here in Boca Raton. So grayteam.org is an amazing place if you want to help U.S. military veterans and active service military folks who are at risk. Great organization led by Carrie Reichbach, my good friend.
That's awesome. I love that. Thank you for sharing that. So is that the part of the Bauman Philanthropic Foundation? Which I'm seeing in your background, and anybody listening to the podcast isn't seeing that. So
Bauman Philanthropic Foundation actually started with me and my wife. We've done pro bono work for folks who have been injured in accidents, whether it be eyebrow or eyelash trauma, car accidents or dog bites. We also provide cranial prosthetics, for example, for a woman who was burned as a child in a kitchen fire. And so those kinds of things we've always done for 25 years. But it was a number of years ago, we founded the 501c3 called the Bauman Philanthropic Foundation to provide those services to those folks who need hair restoration and financially couldn't afford it. Yeah. And there's an application process. If you know someone who's been injured and lost their hair in some way, shape, or form, that would include sideburns or eyebrows and eyelashes. We've done reconstructive work for many patients through my foundation. And also we do a lot with education. My wife has a master's degree in education. She was a kindergarten teacher for many years, just recently retired to enjoy her life. But we have a passion for education and teaching and training. And so Bauman Philanthropic is hair restoration with some education components to it as well. That is completely separate from me being the medical director of grayteam.org, which is a 501c3 specifically for military veterans and active military folk who are at risk for PTSD related suicide. So, which is a big problem since the pandemic, and obviously increasing. Picking up kind of where the VA left off, we try to get these guys off of their medications that are, dulling their mind and dulling their brain, so to speak, and getting them back to a healthier lifestyle. So we bring in all the biohacking materials that you can imagine, couple that with nutritional guidance, one-on-one training. We body scan them. We provide mindfulness and meditation and everything from Qigong to acupuncture and hyperbaric oxygen to far infrared sauna, photobiomodulation, a PEMI, a VEMI. So we do a lot of pulse electromagnetic field for them as well. and a lot of social support. So there's a billiards table there too, and
Love
cookouts
it.
when on Memorial Day. But that's where I dedicate my time. And we've got some really nice big events. So if there's any vendors out there that might be listening, who want to get involved to help U.S. military veterans, certainly we would love their help. And we've had great support from the biohacking community. We use BrainTap, we use Happy, we use the
Pure Wave you just mentioned.
Yeah, Pure Wave, donated their both beds, the PEMI and the VEMI, many others, and some of the veteran organizations are donating coffee and other things as well. But photobiomodulation from Weber in Germany, the Theralite. We've also talking to other companies in that realm as well. So Sunlight and Far Infrared Sauna. All have stepped up and donated everything at no charge to those military veterans that need that kind of help. And so I'm thankful for them. And of course, gratitude is my favorite biohack. So I'll put a little thanks out to all those folks who are deeply involved with Great Team. Those are my people.
Well, that sounds amazing. And that is, I think, a beautiful place to maybe bring our conversation to a close, seeing as it is the middle of your workday and probably there's somebody waiting for you on the other side here. So Dr. Bauman, thank you so much for this. And hopefully people caught that you also do eyebrows and eyelashes, which we can talk about another day. Any hair that needs to, that should be there, that isn't there anymore. So maybe we can just finish with how people can find you and work with you or reach you, or maybe work with someone you've trained. And also there will be an offer for the audience in the show notes. But in the meantime, let's just finish with you.
Yeah, absolutely. So for any men or women out there who are struggling with a hair loss condition, whether you're just starting to see the signs or you've decided that now's the time you want to do something about it to get things back in order and to get your hair to stick around, to enhance, maintain, or restore your hair, we can treat you from across the globe. Nearly 50% of my patients start out connecting with me virtually. So the best way is a virtual consultation. You can request one at baumanmedical.com, BAUMAN, for those who can't see the lower third there, baumanmedical.com, and you can just click on schedule consultation and it'll guide you. If you're local to South Florida or you happen to be visiting, or you're going to be in the local area, we're halfway between Miami and Palm Beach. So we're on the east side of the state. And we'd be happy to see you in person. We can do a lot more investigative diagnostics and measurements, obviously, if you're here. But as I said, many patients connect with me virtually at baumanmedical.com. You can also find me and DM me on just about every social platform that you can imagine. It's at Dr. Alan Bauman. If you want to take a look at some of the things on my personal side, or at Bauman Medical on Instagram. But, I'm happy to chat with anybody. And if you just want to ask a question, you can go to baumanmedical.com/ask. And just ask away whatever questions you have about hair loss, hair restoration, transplants, or any of the regenerative technologies we've talked about. I look forward to helping you and giving you a brighter day ahead.
Wow, that's amazing. Well, thank you again so much for your time, Dr. Bauman. This has been amazing. I'm so glad we had this time together.
Well, thanks so much, Natalie. I really appreciate it. And I hope your audience appreciates it.
Oh, I think they will.
I'm sure they will.
Thank you.